Coming to the factors influencing the healing in general, they can be classified into local factors as well as systemic factors. Any infections associated with septicemia or any other bacterial microorganisms might hamper and delay the process of wound healing. This might also be one of the local factor which affects wound healing. Other than that, poor blood supply. If the patient is having a compromised blood supply because of the wounded area, suppose in a large scar or large wounds, the vasculature is not being sufficiently supplied, it might also result in improperly formed granulation tissue and might result in, so this might also result in improper wound healing because in case of large wounds. Foreign bodies might also hamper the formation of granulation tissue, as well as if the neutrophils have not removed the neutrophils or the macrophages have not debrided the area of injury completely, it might cause the hampering of the neutrophil chemotaxis as well as the endothelial proliferation also, and might result in might affect the healing. If there's any movement in the area, if there's mobilization in case of fractured healing, it might result or it might also hamper the healing of the fractured wound. On exposure to ionizing radiations as well as UV light might also hamper the wound healing, and because it might also alter the proliferation of the epithelial cells. Exposure to UV radiation as well as ionizing radiation might also result in this kind of delay in the wound healing. Coming to the type, size and location of the injury, based on the type, size and location of the injury, it might be a delayed wound healing or a rapid wound healing. So if it is a small size of the injury, then there will be rapid healing. Suppose if it is a large, then it might take longer time of duration for healing to occur. Based on the location also, similarly, if there's continuously there's mobilization of the area, then it might also delay the wound healing. So these are certain local factors. Coming to the systemic factors, in case of young age group, the healing is rapid when compared to that of the old age group. And nutrition, suppose if there's any delayed or insufficient proteins or deficiency in vitamin C, can also delay the wound healing. Systemic infections can also hamper wound healing. It might delay the wound healing. Glucocorticoid administration can also delay the wound healing. Uncontrolled diabetes might cause a compromised kind of wound healing. Hematological abnormalities might result in incomplete formation of the vasculature and granulation tissue as well as neutrophil chemotaxis to the area of injury. All of them might also compromised for the might result in compromised wound healing. So these are certain factors which influence the healing of the wound. Coming to the complications of wound healing, as already explained, infection is also one of the reasons for wound healing to occur, for a delayed wound healing or a compromised wound healing to occur. Coming to the implantation or epidermal cyst can also be formed when there's if any epithelial cells are remaining at the area of wound, it might result in an epidermal cyst formation. Pigmentation can occur at the site of wound healing when suppose there's any deposition of the hemosiderin, can also result in such kind of pigmentation and give a brownish or muddy red color. Deficient scar formation, this because of the incomplete proliferation of the fibroblasts and the incomplete formation of the granulation tissue might also result in deficient scar formation. It is mostly seen in large and untidy wounds. And coming to incisional hernia, usually when the injurious agents are open, in case of conditions like laparotomy, incisional hernia can also be seen. Hypertrophic scars and cleared formation. Hypertrophic scars, they are the excess of scar tissue formation which are usually confined to the margins, whereas cleared formation, it is the excess of scar tissue proliferation at the center of the wound. So this is known as cleared formation. So these are certain complications which can be seen. So the picture shows the cleared formation where we can see there's excess of fibrous scar tissue formation seen at the center, which is raised above the normal level of the skin level. Coming to excessive contraction can also be seen in large wounds. It can also be seen in case of contractures as well as cicatrization can also be certain conditions where we see that there's excess contraction. Neoplasia is a condition where we see rarely that the scars might result in neoplasia. We see a proper example of Marjolin's ulcer can be given as an example for neoplasia to form from a scar tissue. So these are the complications of wound healing.